I'd like to welcome Fiona Tan to this podcast, who is a dentist, and I'd love you to tell us about how long you've been working as a dentist, Fiona.
Oh, thanks, Peter. Yep, my name's Fiona, and I've been working as a dentist for almost 30 years now. So, primarily in private practice, but I started off working in the Air Force as a dentist. Yeah, but I've been a dentist for a long time.
Oh, thank you so much for joining us. We really wanted to look at oral health during a pregnancy loss because there is not much information around anything in pregnancy loss in the body. And Annika Wilson did the research behind this, and she couldn't find anything as well. So we wanted to look at what actually happens in a mouth or around the gums and teeth, especially when it comes to hormones. And we just wanted some really practical tips for women.
Yeah. So, as you mentioned, after a pregnancy loss, there can be certain physical changes that can occur, and gum symptoms, I guess, are one of the more unexpected conditions that can occur, but they can still affect, how you're feeling day to day. So, some women experience sore gums, bleeding when brushing, or the gums feeling swollen or puffy. Sometimes this occurs even weeks or months after a pregnancy loss. As you said, while there's no direct research on gum health after pregnancy loss, we do know that these symptoms are really common and may continue while your hormones are settling.
And so, what practical advice would you give women who are experiencing any of these symptoms?
The main mechanism we think for this condition is that the hormones are basically causing our gums to overreact to any plaque that's on our teeth. So the best thing to do is to just try and maintain really good oral hygiene. So brushing your teeth regularly but very gently, using dental floss to clean in between the teeth. Even if the gums are bleeding, still use the floss gently. And if you find that the symptoms are severe or they persist, one thing you can do is go along to your dentist and just get a check and a clean just to see if there's anything else underlying.
Okay, and what about mouthwash? Because there's lots of controversy about mouthwash. Because from my point of view, it's a lot of the mouthwashes are really high in alcohol, and if your mucous membranes are already a little bit sensitive, how do you feel about mouthwash when it comes to these sorts of things?
Mouthwashes have their place, but not generally as part of your daily routine. So if you're brushing your teeth regularly and cleaning in between your teeth with dental floss or interdental brushes, then generally a mouthwash isn't necessary. So sometimes a mouthwash can help if you have a short-term inflammation in the gums, but it generally doesn't need to be used long-term. And as you mentioned, they can be a little bit aggressive on your tissues. One thing that you might want to try if you are experiencing some swelling in the gums is even just rinsing with a warm, salty mouthwash. That will do a very similar job to a lot of the mouthwashes you get from the supermarket or the chemist, and they're just more gentle on your tissues as well.
Okay, well, I think, that's really practical advice, and that's really all we want to get out to women for them to know that it is something that could happen, that it's not abnormal, and that it's nothing to panic about. But if they do have issues, that the dentist is the best person to start with when it comes to oral health.
Yeah, that's right. I mean, definitely just try the thorough but gentle cleaning in the first instance. And if you find that things are persisting, then it's always worthwhile popping into the dentist just to see if anything else needs to be done.
Thank you so much for joining us, Fiona. We really appreciate your advice.
Pleasure. Thank you.